My name is Human Fatemi. I'm a professor of reproductive medicine. I am the Group Medical Director of our fertility clinics. Which we have initiated about 2 years ago in India. This is a part of a chain which is worldwide present in the Middle East, Dubai, Abu Dhabi. Fertility or infertility, it's a treatment which has initiated about 40 years ago. So it's a very new field of medicine. Having said that, if you go to an ophthalmologist, if you go to a cardiologist or any other physician, these specialties have developed over the past centuries, if not millennia. So what we do is only 40 years old. It means basically we don't know what we are doing. So in order to be successful in what you do, you need to contribute to research, and that's exactly what we do. So we have, from the beginning of when we initiated these clinics, we have invested a lot in clinical research. So we publish on regular basis scientific papers in order to translate that into clinical practice, so our patients benefit from the knowledge we have gained based on our research. The chance of success is linked to the quality of the egg, and it's linked to the quality of the embryo. Now, what is important to know, when you have an egg or an embryo, it might look beautiful from outside, but it might be damaged from inside. It's like you want to buy a car, and you look at the car from outside, you say, this is a beautiful car. However, if the engine is not good, still it's a beautiful car. But would you buy that car? No. The same is with an embryo. You see, the embryos sometimes fool us. They tell us, we look good, we are beautiful, but they are looking good from outside. So when you ask what is the chance of conception, then we need to define what embryo are we dealing with. Is it a genetically tested embryo? Is it an untested embryo? How does the embryo look like? So scientifically, we published recently a paper. If the embryo is top quality, it's tested, the chance of conception is 80%. It's very high. If the embryo has been genetically tested, so you tested the engine, it's normal, but the quality is poor, the chance is maybe 40%. So when you say what is the chance of success, I think there are many variables which needs to be addressed. One of them is the genetic information. The other one is the quality of that embryo. Furthermore, you need to understand, is it put back in a fresh cycle or is it put back in a frozen cycle? We know that in a frozen cycle, the womb is much more receptive. The chance of conception is significantly higher. So all these variables do play a role. Now, how far is it accepted in India? In Europe and in the West, 30, 40 years ago, people didn't talk about that. It was a taboo and it was really a hidden game. Today, it's widely accepted in the West. And my feeling is, by coming often to India, that also here we are undergoing a change. It's become more acceptable. So people accept it much better than it was maybe 20 or 30 years ago. In order to do IVF, it's a very complex process. You need to have, first of all, the physicians and the embryologists, they need to have really a good formation, education, which takes many years. Furthermore, you also need to set up a lab. You see, the environment that you create is very costly. You need to have a clean room, you need to have incubators, you need to have a monitoring system, you need to have a clean air. So that is indeed very costly. Now, you can make IVF very cheap. Again, going back to the cars, you can buy a cheap Chinese car or you can buy a Ferrari or a Porsche. Obviously, for the Porsche, you pay more than you would pay for a Chinese car. I didn't say Indian car, I said Chinese car. So basically, for the quality, it costs money. But can you offer it cheap? Yes, of course you can also offer it cheaper, but obviously the quality of care would be less. So if you are interested in high quality, unfortunately still it is expensive. But at the end, you want to have less complications and you have the best and healthiest children. And this is what we are investing in currently. It is a big question mark. Really, COVID has increased the infertility. We know that globally spoken, it's 15% of couples have infertility issues. Now, COVID is a temporary issue. We know, for example, that men who get infected because they have a rise of body temperature, that reduces the sperm production, but it's a temporary issue. So it is not that COVID by itself had a huge impact on fertility. It was a temporary issue. Even if you have a cold, if you have fever, your egg quality decreases, your sperm quality decreases. This will be maybe 2-3 months, and it goes back to normal. So I don't think that COVID itself had a major impact on male or female infertility, and also there are enough scientific data. On the other side, there was an impact, but it's a temporary impact. But then you go back to normal. I mean, we are present in 6 cities, and with our clinics, we are all comparable with the results because we all follow the same SOPs, we are all on the same level. I mean, at the end, healthy and balanced food is important. With man, hot temperature is bad. You see, taking hot showers is not good. Tight underwear is not good. Too long sitting is not good. So all these issues play a role. Balanced food, vegetables. You know, there is a diet, it's called Mediterranean diet. This is really a balanced food with a lot of vegetables. That is very healthy. What I didn't mention, sun exposure for women is extremely important, especially 9-10 o'clock in the morning. Sun activates and makes eggs live again or come to life. So this is why, if you ask lifestyle-wise what can they do, I think in the morning 15-20 minutes sun exposure is the best that you can do with a balanced food, especially fruit and vegetables. I mean, as I mentioned, as I elaborated previously, IVF is a new field of medicine. In order to be ahead, you need to contribute to clinical research, and that's what we do. So as a group, we try to invest a lot of effort in clinical research in order to enhance the outcome. It's directly translated in to the clinical activity. Furthermore, you know, we are not only gynecologists, we have in the group our own andrologists, and we have our own genetic lab. So basically, we have a holistic approach, and this is important. You see, you have everything under one umbrella. If you come as a couple to do a fertility treatment, it's not a woman, it's not a man, it's a holistic approach. That's also what makes us unique.